I'm going to be discussing some research that we have published on outcomes before and after liver transplant in patients who are obese. The goal of the study was to understand outcomes after transplant in patients who are obese and whether these have improved over time, and also to get a sense of how patients with obesity do while they're awaiting liver transplant, and to see how much they benefit from liver transplant, which we call transplant survival benefit. So we quantified obesity in a very standard way, which is according to the classification of body mass index that's put out by the World Health Organization. And with that, patients who have body mass index between 18.5 to 29.9 are considered normal or overweight. Those between 30 and 34.9 are considered obese, 35 to 39.9 severely obese, and then greater than or equal to 40 morbidly obese. And that greater than or equal to 40 or morbidly obese group was the patients that we really wanted to focus on in our study. What we found is that over the past 9 years, outcomes for very obese patients, which we also call the morbidly obese, have really improved and now are no worse than patients who are less obese, which is different than the previous era in the early 2000s, in which it seemed like very obese patients did worse after transplant. This was an analysis of the National Transplant database, so we do not have any granular information on how the patients felt or things like that. What we know is that they did not die more frequently than less obese patients, and we also found that their organs, what we call their graft, did not fail more frequently, so they didn't need to be retransplanted despite not dying more frequently than less obese patients either. Based on these studies from the late 1990s and early 2000s that showed that very obese patients did worse after transplant during that period, actually practice guidelines recommend against doing transplants for very obese patients. And there's been a survey within the last few years that showed that over 85% of US transplant centers do not perform transplants on morbidly obese patients for that reason. There have been a couple of other studies recently that suggested that these outcomes may have improved after transplant for the morbidly obese, and we verified that in our analysis. Unfortunately, that's usually not the case. Obviously, there's some people who are able to lose weight after transplant, but some of the medications that we use can make that more difficult. They can actually cause diabetes and make it more difficult to lose weight, for example, steroids. As I already mentioned, we found that post-transplant outcomes have improved. And one thing that we found that was really novel in this study was that patients who have morbid obesity while they're waiting for transplant have much higher mortality than less obese patients. And this has not ever been found before. So I think this was very interesting. The explanations for that are really unclear. There's been some other studies that have shown that very obese patients might have more infections or have more types of liver failure, but the way that we did our analysis using this National Transplant database, we can't tell the reasons for those things. Liver transplants are unfortunately a scarce resource. The vast majority of liver transplants performed in the United States are from deceased donors, and a small proportion are from living donors. So it is true that liver transplants are hard to come by. And we need to be sure, of course, that we're not doing transplants in people who don't benefit from the transplant, and that we provide transplants to people who will benefit the most. And also we need to, of course, make sure that we're trying to minimize the number of deaths in people waiting for transplant. So we're always trying to balance multiple different concerns when we're thinking about liver transplant. Actually, because the very obese patients have a higher mortality or a higher risk of dying while they're waiting for transplant, but they have the same outcomes after transplant, that actually means that the very obese patients get even more survival benefit from liver transplant than less obese patients. So what we found, I think, is that the morbidly obese patients that the rules for them really should be loosened, and that they really should be given the same access to liver transplant as less obese patients. We hope that at least our analysis, while it may not completely change practice overnight, will cause surgeons and transplant centers to realize that perhaps they have been a little bit too restrictive for these patients and to open the door to performing transplants in them. And it is important with transplant to be cautious, and you want to be sure that as we open the door and are less restrictive, that we still continue to see the good outcomes with these patients that we found in our study. We hope to study more the reasons for why the morbidly obese, the very obese patients do worse while they're waiting for liver transplant. Again, as I mentioned, there's some studies that suggest this may be related to infections or increased liver failure, but it's really not known, and we need to understand that issue better.